Hello friends, today we are going to see about the apnea test which will be useful to diagnose the brainstem death patient. I think it will be useful for your day-to-day clinical practice. Okay, let's see. There should be evidence of irreversible brain injury in the form of loss of consciousness and cessation of spontaneous breathing. We have to exclude the other causes. We have to start minimum 6 hours from the admission or 6 hours from the identification of clinical brainstem death. These are the brainstem reflexes we have to see: pupillary reflex, Dulce movement, corneal cough reflex, gag reflex, caloric testing, and supraorbital ridge pressure. And what are the certifying doctors? There should be RMO in charge of the hospital, neurologist or neurosurgeon, physician or intervention. Mainly there should be a team of 4 doctors. And biochemical parameters: mean arterial pressure more than 60 mmHg, and blood glucose level 60 to 360, sodium 120 160, potassium 2.5 to 5, pH 7.3 to 7.45, and carbon dioxide 30 to 45, and oxygen is more than 75, and body temperature more than 35 degrees Celsius or 95 degrees Fahrenheit. And apnea test, we have to pre-oxygenate the patient 100% of oxygen for 10 to 15 minutes and adjust the ventilator setting. There should be a baseline ABG we have to take before proceeding for the test, and we have to disconnect the ventilator and oxygen 5 liters per minute through the catheter we have to place in the ET tube, and we have to monitor for 8 to 10 minutes to observe any spontaneous respiration is present or not. Post procedure, before connecting to the ventilator, we have to take one ABG, and how we will tell it's positive negative, which means positive in whole 8 to 10 minutes there is no respiratory effort, and post ABG it shows CO2 more than 60 mmHg or more than 20 mmHg from the baseline, and negative means respiratory effort is present. When to abort this procedure? If the patient went for hypotension less than 90 mmHg or any arrhythmias, a saturation decrease less than 85%, and we have to repeat the procedures after 3 hours after hemodynamically stable. If any brain presence, then we have to repeat for 24 hours. Then if it is positive, we can proceed for the second apnea test after 6 hours in adults and 12 hours in pediatrics and 24 hours in term babies. And we have to observe the same procedures, and the PCO2 is the target value of the same more than 60 mmHg. We have to declare the time of death of the brainstem death of the patient. And there are the ancillary tests other than clinical brainstem test is CT angiogram, digital suppression angiography, and MR angiography. Thank you all.